Good afternoon. I'm just going to give it a minute to let everyone get into the webinar and we'll get started really soon. Right, good afternoon everybody, and a very warm welcome to it's our final webinar in the series on preventing leading violence prevention in education and putting what works into action. My sincere thanks to everyone that's joined today's webinar. You are most welcome, and I hope you enjoy this, the fourth of four of our webinars. I've been hosting these along the way and I am honoured to do so. This is such an important topic, one that feels really important to us. I'm the Regional Director in the Department for Education for Yorkshire and Humber, and I know in my region this is a subject which is very important to lots of our school system leaders, and so really delighted to be here today hosting today's webinar and to be part of this conversation. We've really wanted to make sure that we put evidence at the heart of strategies for doing work in this space. And so our whole series has been based on making sure we share that evidence, what works well, and help people to put that right at the centre of what they're doing. We think that schools are uniquely placed to help respond to violence because they're trusted environments for our children. You have daily contact with children. You can notice those changes in behaviours. You see that attendance and you understand how well children are feeling. And therefore that puts you in a really important place in the system. When we work on this together as well in partnerships, locally and nationally as well, we're able to have most impact. So today's session is focused on when and where violence is most likely to occur, thinking about the school day and journeys to and from education settings. And the session will also explore what can be unproven approaches or potentially harmful approaches. And so while we've used this series to really explore the evidence-based approaches, we want to bring to your attention as well some things that we don't think work and why we should avoid those, because the resource is very limited and we want to take our best bets in terms of having impact. I think you're all here today because you share this understanding, but violence has such a significant impact on children, their safety and well-being, and it affects their mental health, attendance, their ability to learn. So it's such an important topic. We know that violence is concentrated in specific places and at specific times, and that's a big thing we're going to explore today. And so prevention is most effective, we know, when schools are able to target those times of day, those places, and do so in conversation with pupils and staff and the local context. So hopefully today's conversation sparks lots and lots of interest to be able to think about this more carefully. Through this series, we've been promoting the EPIC self-assessment. So please do, if you haven't already done that, try and run through that self-assessment for your trust, your schools, your setting. It's a really good way of starting to think about this. And also we want at the end of these sessions for you to be able to support the implementation of proven practice. So think about what you've heard today and think about how you might implement that through your settings. As I said earlier, today is the final session in four parts. If you've been with us for the previous three and are here for the fourth, thank you very much. And I hope this is a good final instalment in the series. If you've missed any of the prior series, then you are able to watch those all back on YouTube, and we'll make sure those links are there. Just a reminder of what we've covered so far. We've done a first session on evidence-informed practice, that first webinar back in November. where we introduced you to practice, and we had that safeguarding case study from Arc Globe in Southwark, and highlighted the importance of staff skilling up and information sharing. We then did a session on the role of attendance, exclusion and trusted adults. And then in number 3, we moved on to social and emotional skills development. And today's final session, as I said, is on violent times and places and exploring some unproven approaches that you might want to avoid. So we're recorded, they're all recorded. You can watch them back at your leisure, or you can share them broadly across your networks as well, and we'll get that link into the chat. As you go through today's session, just 2 things we'd like to take away as actionable steps. So I've just mentioned the EPIC self-assessment tool, so please do have a go at doing that. And at the end of the session today, we'd be really grateful if you would fill in the feedback form, which again will be posted in the sidebar for the webinar. You'll be able to get the link and you'll be able to tell us what you have found useful about these sessions, and that will really help us to home in on improving them and different topics we might want to explore in the future. So really grateful to the Youth Endowment Foundation for their support with this series of topics. I'm really delighted to be able to introduce Joe Collin from the YEF, who will introduce all our other YEF colleagues, and he will lead us through the first session. So I'll hand over to Joe, and thank you very much.
Fantastic. Thanks, Alison. And yeah, it's an absolute pleasure to be here for this final webinar today. I'll start by saying I'm absolutely full of a cold. So do forgive me for sneezing as we go through. It's the benefit of a webinar session that we're not in person and I'm not spluttering and sneezing all over you. Yeah, my name's Joe Collin. I'm the Head of Guidance and Policy here at the YF. Prior to joining the YF, I worked at the EEF, the What Works Centre, for reducing the attainment gap, which I'm sure is a What Works Centre education colleagues will be very familiar with. And prior to that, I spent some time in the classroom as a secondary history teacher in Birmingham. I'm also joined by the fantastic Ben Araya Lorraine, and Ben will talk us through particular elements of the EPIC self-assessment tool towards the end of the session. Now, as Alison has outlined, we've done some previous webinars. Some of you will have been at them, others may not have been. So just very briefly, I just want to introduce you to who we are at the Youth Endowment Fund. As I said, so we're the What Works Centre for Protecting Children from Involvement in Violence. So in 2019, we received a £200 million endowment from the Home Office, and we use that to try and create a world where no child becomes involved in violence. The way in which we do that is a very similar way in which the EEF operate. So we do that by trying to find out what works, and then by building a movement to put that into practice. And so we fund research, we synthesize evidence in our own toolkit, and we produce a range of guidance reports. We do so across 7 sectors, and colleagues on the call will, I'm sure, will have worked across a variety of these sectors, whether that be children's services, health, policing, or the youth sector. But today we focus on education. And as is always really important, before we get into the evidence-based guidance on what education settings and what schools, colleges and AP settings should be doing, to really underline why is this important? Why is violence a really critical challenge that the education sector must meet? And the first reason is that violence impacts children's lives. So we survey 11,000 teenage children every year. It's the biggest survey of its kind. In the results that we published in November, 1 in 5, 18% of teenage children say they've been a victim of violence in the past 12 months. 1 in 8 admit to perpetrating violence, carrying out violence themselves. And 50%, half of children say they'd witnessed violence being committed against someone else. Violence is prevalent. It's impacting children's lives. And we shouldn't be surprised, therefore, to see that violence is impacting education. And, anyone who's an educator should therefore be, really concerned about it and should want to meet and address the challenge that it poses. So in 2024, this was in the same survey that we did the previous year, 10% of 10,000 13 to 17-year-olds we surveyed said they missed school because they were worried about violence. And that rises to over a quarter of children who themselves have been a victim of violence. Now, of course, if you're not in school, that's going to be impacting, all manner of educational outcomes. Most notably, of course, your attainment. And so it's so critical that we get children back into school. And clearly violence is having an impact on that. We can also see from that same survey, nearly a quarter of those 10,000 teenagers across England report that the fear of violence has taken a toll on their mental health. It disrupts their sleep, it suppresses their appetite, and it makes it harder for them to focus in school. Again, all of those things make providing education, make improving children's outcomes more difficult. And so we must try and address violence. We've also got, some really similar reflections from teachers. So we partner with Teacher Tap really regularly. And 18 months ago, just before Christmas 2024, we asked over 7,000 teachers in England, this is across both primary and secondary, right across England, in the past term, has a child committed any of these incidents in your school? 7 in 10 of those teachers said that a child had committed a physical assault against another child within the last term. Over 4 in 10, 42% that a child had committed a physical assault against a teacher. 13% said a child had brought a weapon into school. And of course, that 13% is only 13% that teachers know about. There may well be more, be more children. We also see sexual assault occurring in this survey. So 10% report that a sexual assault has been committed by a child against another child, and 2% against a teacher. So again, clearly, this is an issue that schools and teachers are contending with. The big challenge that we then have is that schools and teachers and even designated safeguarding leads don't necessarily have the knowledge that they need to combat that. So we asked, again, over 8,000 teachers right across England in the same survey, and they responded by telling us that 7 in 10 teachers are not confident or not at all confident in identifying and delivering evidence-based interventions for preventing children's involvement in violence. And that's why this webinar series exists and why the guidance that I'll come on to has been published. But it's really important that underline here, we're not blaming teachers or schools for this at all. I've been a teacher, combating violence and doing so in evidence-based ways was certainly not always at the top of my agenda. There's so many things that schools are contending with. And really critically, we must acknowledge that teachers are very rarely trained on this. So 82% of teachers we surveyed, and even 72% of designated safeguarding leads report receiving no training on serious violence in the last 2 years. So here we have, a profound problem. And despite that, we haven't yet been able to provide enough training to teachers to address it. But it's not all bad news, and Alison alluded to this at the start, that the critical and really unique role that education settings play in combating violence, in protecting and preventing children's involvement in violence. And schools, colleges, AP settings really do play a really crucial role in that. And that's because they provide safe, trusted spaces for children. Yes, violence happens in schools, but violence happens in schools because it happens in society. And for the vast majority of children, school is a safe place. 82% of children that we survey, of those 10,000 children, say they feel safe at school, and that's fantastic. Schools also offer a variety of evidence-based interventions to support children and prevent their involvement in violence. And particularly if you look at webinars 2 and 3, where we really focus on the provision of mentoring, targeted support provision, developing social emotional skills via things like anti-bullying programs, relationship violence reduction sessions, therapeutic interventions. Schools are delivering a variety of interventions that are evidence-based and prevent children's involvement in violence. And of course, then finally, schools play a critical role in safeguarding children. And everything that it says in keeping children safe in education, in working together to safeguard children, all of that guidance that schools then implement to protect and safeguard children means that if you're in school, you're more likely to be protected. The challenge for us is how can we use that unique role that education settings, that schools, colleges and AP settings play, how can we use that to really maximise it and make sure we're delivering evidence-based practice to protect children from involvement in violence? And that's where our education practice guidance comes in. And this education practice guidance has been what the webinar series has been structured on and focused on. So in the Q&A links that have been shared, you'll see the webinars that we've done already on keeping children and young people in education and providing trusted adults. The last session was also on developing social and emotional skills. And today I'm going to focus on targeting efforts at the places and times where violence occurs and cautiously considering unproven strategies and avoiding harmful approaches. Now, those are the headlines and the guidance. And it's really worth noting, and I always note this when we present this and when we present this to teachers, that often a very legitimate response that we get when we present these recommendations is, well, yeah, obviously, we know a lot of that. And that's fantastic. Like a really core fundamental element of a good evidence-based recommendation is that it's feasible and it's deliverable. So it's always a really good message for us when schools turn around to us and say, yeah, we're doing a lot of that already. To which our response is, fantastic. Let's do some more of it. Let's make sure we're implementing it in line with the evidence. And let's maybe stop doing some things, which I'll come on to. Just briefly, before I move on to recommendations 4 and 5 here, just a bit of context as to what's gone into this guidance. So the guidance is based on the best available international evidence on violence reduction. And a lot of that draws on the YEF toolkit, which is a compendium of all of the best available evidence-based bets that we have from the violence reduction literature. We've used that literature. We've also done some reviews of practice, some surveys of children, some surveys of teachers, and we've had lots of conversations with current practitioners and experts in this system. So our expert panel included people like Rachel D'Souza, the Children's Commissioner, also the Chief Inspector of Ofsted, and a number of different head teachers from a range of different settings across the country. So let's focus on recommendations 4 and 5, targeting efforts at the places and times where violence occurs and cautiously considering unproven strategies and avoiding harmful approaches. So recommendation 4 then. So this is, very much born out of the violence reduction literature more generally. And that's the point that it's really critical in all violence reduction efforts to really target our efforts at the places and times where violence occurs. The reason why we need to do that, and again, Alison alluded to this at the start, is that violence happens more often in certain times and in certain places. And so this recommendation suggests that schools, colleges and AP do 2 specific things. Survey children and talk to staff to determine how to focus your efforts, and meet with partners, particularly multi-agency safeguarding partners, to understand the local context and coordinate your safeguarding response. Now, just to dig into a bit more detail on that and why this is an important recommendation. The first is a really well-established principle and tenet of the violence reduction literature, and that is that crime and violence tend to be concentrated. And they're concentrated in what we might call hotspots. So 50% of violent crime happens in just 2% of street segments. And we can see how that plays out in particular areas. So in London, nearly 70% of knife-related homicides happen in just 1% of geographic areas. Now, those specific areas can be different types of locations. So they can be quite small, such as a bus stop, a tram stop, a train station. They could be a particular geographic area, like a school route, or could be a broader section of a park or a street. And there are several ways in which a hotspot might form. So some locations, such as transport hubs, may simply have lots of people gathering in them and passing through. A really good example is there are lots of examples and a really high prevalence of theft on Oxford Street or in big shopping centres, because there's lots of people walking through. So that's one way in which a hotspot can form. Another way in which they form is that they attract people who are especially likely to become involved in violence. So one of these might be the sort of nighttime economy, right? Might be, your sort of Broad Street in the middle of Birmingham, your clubbing strip in the middle of Birmingham. People will go out, they'll drink alcohol. And after consuming alcohol, they're more likely to engage in violence. And so you might then have a hotspot of violence in a particular place as a result of that. The final way in which hotspots can form is they can also form if there's a sort of limited guardianship or regulation of vulnerable people, and particularly vulnerable children. And we really see that in school travel routes. Colleagues who will work in education settings I'm sure will recognise that it's a real sort of risk moment, risk place, risk time, which I'll come on to, around school travel routes, children travelling to and from school. So that conception of place and hotspots is really important to think about. both for education, but also just more generally for violence reduction. And actually, hotspots policing is a particular strategy, a particular evidence-based strategy that police use really extensively, based on exactly the same evidence that crime and violence tends to be concentrated in particular places. The second sort of reason why this recommendation is really important is around the concentration of violent offences and time, particularly for children. So 30% of the 10,000 teenage children who we surveyed in 2024 who'd reported being victims of violence, so nearly a third of children who've been a victim of violence, outside school before or after the school day. And that survey finding really tallied with what we know about the makeup of violence and particularly serious violence. So there's a really interesting study that was published in 2018, and you can see the bar chart on the right hand side of this slide here. And they did an 11-year retrospective cohort review of a major urban trauma centre, a hospital in London, that analysed nearly 2,000 patients who were under 25 who presented to hospital with a stab injury from assault that wasn't caused by accidental harm, wasn't caused by self-harm, that was caused by assault. The sort of red-pink bars are the really interesting ones for us if we're focusing on children. What you can see along the x-axis at the bottom is the time of day. On the y-axis, the proportion of cases admitted to hospital at those times of day. And you see the peak for children between 4 and 6 p.m. So 22% of injuries of serious violence, serious knife injuries that children had received and were admitted to that hospital. 22% were between 4 and 6 p.m. And so it's really critical that we target our violence reduction efforts at that time. Again, if you've ever worked in a school, college or AP setting, that will really tally with your experience. This sense of lots of children leaving school at the same time, mixing with each other, mixing with children from other schools, and it being a moment of risk. So what should you do about it? Well, the first thing is just to say you should have those things in your mind at all times and have that sense in your mind of, right, I need to target places, I need to target particular times. But beyond that, it's also important to really lean in and try and understand your particular context. And the best way to do this is to talk to children and talk to staff. So really, basically, you can survey children and ask them, how safe do you feel? How safe do you feel in lessons, in corridors, in the playground, at lunch, before or after school, and when travelling to and from school? Some of the most evidence-based anti-bullying interventions, there's a fantastic program called Learning Together, which features in recommendation 3 of the guidance report, and which EEF have previously evaluated and found that it had a variety of different positive impacts on educational outcomes. A really interesting part of that program is it brings children together at the start of the anti-bullying program, and it asks them, where do you feel safe? What times do you feel safe in school? How can we support you to reduce bullying? To really understand from children themselves the context of the school and the context of the wider area. There's a fantastic quote here from a brilliant school leader, Anna Wallace, who works on a program, a DFE fund called Safe Task Forces. And this is a program which is all about and aligns so well with this recommendation, where areas and education settings within areas receive funding to really try and understand their local area and then target interventions at their local area, at particular places, times, and children to prevent their involvement in violence. And Anna really astutely says here, young people have a right to have a say in the matters that affect them and to have their voices heard. It's essential that we embed mechanisms into our practices to hear their voice and gain insights into their lives. We must always follow the principle, nothing for us without us. With regards to evidence-based practice, Anna's spot on. And there are a range of methods that we can use to do this. So really, basically, we can use some online surveying of children, paper-based questionnaires or focus groups. You can conduct interviews with children. A really nice anonymous way to do this is via feedback cards that you might have in reception at the front of your school, college or AP setting. Lots of education settings also have school council or similar structures. Now, it's really important, and a lot of the evidence-based anti-bullying programs that do this well make sure that they really think about this when implementing. It's really important that you capture the voices of all children, not just the sort of, the particularly keen children are always happy to give you their opinion. Make sure that you're also collecting the opinions of particularly vulnerable children and children, who may be struggling with their behaviour, because those are the children who will be more at risk. Also really critical to ensure that you talk to staff. Staff will have a really good sense of, where are the danger zones in the playground that, it's useful to stand if you're on break time duty. Which times are we worried about? Which corridors were we worried about? Even which travel routes to and from school should we be concerned about, and might we look to provide some additional support? And really make use of the intelligence and understanding that you have within the staff body. And then, of course, the really critical thing to do is act on the information. There's no point collecting all of this information and no point really understanding at a strategic level, where do children feel safe and where are they at risk, and then not doing anything about it. And to act on this information, it's all about delivering recommendations 1, 2, and 3. So, for instance, if there's a propensity for violent incidents to be happening at lunchtime in school, could you deliver a sports program at that time? Have a look at recommendation 2 of the guidance on how to deliver that and implement that in an evidence-based way. That's all about making sure that you have a trained, trusted adult who's delivering regular weekly sports sessions delivered over the course of 2 terms, and really trying to use those sports sessions to develop children's social and emotional skills. And of course, making sure the vulnerable children you're particularly worried about are at those sessions is key. Maybe you have problems that occur immediately after school. And so you might think about establishing a mentoring initiative, or working with a third sector organisation that delivers mentoring, and bring them into your setting, and critically do that between 4 and 6 p.m. Again, if you are doing that, really make sure that you're doing that in an evidence-informed way, and you're implementing in line with the best available evidence that is set out in recommendation 2. So that's all about making sure that mentors are trained, that mentoring is regular, weekly for at least 2 terms. Really importantly, making sure that there's careful communication at the end of mentoring, and children are signposted to support at the end of it. Perhaps you've got incidents of bullying at break times. Again, target any anti-bullying activity that you're doing, and ask teachers to position themselves in hotspot areas where it's occurring. Now, as I said at the start, a lot of you in a lot of settings, a lot of schools will be doing a lot of this already, which is fantastic. But constantly try and make sure you're both, always updating your understanding, and never thinking, great, we've got it cracked, we completely understand violence in our school in the local area. Always be looking to update that and act on that. Now, a really interesting intervention that has really promising international evidence that really embodies the principles of this recommendation is a program that was originally called the Safe Passage Program, and was originally founded and delivered in Chicago. So this was founded in Chicago almost 20 years ago now, and it works with organizations who hire and train people in the neighborhood, often family members, and what they train them to do is stand on school travel routes. So the routes by which school children walk to and from school. They stand on those routes, and they make those routes feel safer, and they intervene and support children when there might be an argument or a disagreement, and really make sure that children feel safe on their way to and from school. Now, robust evidence from the US shows that this program is associated with lower levels of crime, not just on travel routes, but more generally. It's not that they're just dispersing and displacing crime to other areas. It looks like they're reducing crime, and those effects look to be persistent over time. Really interesting from an educational perspective, it also looks like they're reducing absence. Now, we shouldn't be surprised about that, given what we've already shared about, 30% of the children that we surveyed here saying that violence has who were victims of violence, saying that violence had happened to them on their route to and from school. And so if you reduce that, they're more likely to want to go to school. Why this is a particularly interesting example is that ourselves and the Home Office funded a version of this programme in the West Midlands called the Step Together programme, which is exactly the same premise, a slightly tweaked model, but the same premise, where school route chaperones are placed on school travel routes and support children so that they feel safe when travelling to and from school. It was led by the West Midlands Violence Reduction Partnership, and they delivered this on 20 routes in the West Midlands, one of which was actually the school I went to as a child. So I was really excited to see this programme be delivered. And there were nearly 20,000 pupils who were indirectly engaged in the programme. Now, we haven't yet done a robust evaluation that looks at evidence of impact, but what we were able to see from our pilot is it's feasible and deliverable. and that school staff, pupils and community members reflected that those chaperones responded to incidents well and supported pupils in the community. Now, I'm not saying just off the bat, right, go and do Step Together, go and do school chaperones. What this is a local area saying, actually, we've got a challenge on school routes. We've got a challenge on children travelling to and from school. We're going to deliver an intervention that addresses that. And a really good example of how to do that. So think about whether, this might be a challenge for you, and particularly in focusing your interventions in that 4 to 6 p.m. period when we know children are most at risk. The second and final part of recommendation 4 is all about meeting with local partners and local agencies to really understand your local context and then collectively coordinating your response. So a lot of colleagues on the call will be aware of the serious violence duty that's been in place for some years now. And that requires a range of agencies, so local authorities, police, fire and rescue services, health services, youth justice services, and probation services to devise a violence reduction strategy and then deliver it within their area. Now, education settings are not one of the named statutory partners that legally have to lead on that and deliver that, but they should be consulted and they should be involved. So if you're a school, college or AP setting, talk to your local authority, talk to the police, talk to health services and get involved so that you're sharing information and improving their response, but also understand what they're doing from a serious violence perspective and think about, right, how can my school, college and AP support in that? Similarly, and colleagues who work in education settings will be very familiar with the second bullet point, right? This is all about if you work in a school, college, AP setting, if you lead one of those settings, or if you're on the governing body, you need to be very clear on what your local safeguarding arrangements are, the role that you play in them. You need to be feeding into them. And that can, again, be a fantastic way to understand what is happening locally to prevent involvement in violence and really make sure that education partners are feeding in information and delivering interventions that support that wider strategy. And our guidance support feature is a really fantastic example that actually embodies a lot of what this recommendation says from Oldham Sixth Form College. So they have a really sort of thriving example of multi-agency collaboration where they partnered with Oldham Council, Transport for Greater Manchester Police and Oldham Youth Service. And through several meetings had established that a lot of violence and offending was happening in the tram stop outside of the college. And this speaks to how hotspots can often be just places where lots of children congregate, and so they work together to identify that as a problem and then work together on solutions. So policing presence and visibility was increased there. Perfect example of that hotspots policing strategy that I mentioned previously. But not only policing, they also increased the provision and support from youth workers in the college and provided trusted adults for children at that tram stop. And their perception following that is that it reduced the antisocial behaviour and the violence that was happening in that area. So a really fantastic example of multi-agency collaboration to both understand the problem and then work together to solve it. Moving on then to the final recommendation of the guidance. And this is all about cautiously considering unproven strategies and avoiding harmful approaches. Colleagues that work in education settings won't need me to tell you that resources can often be stretched and tight. In that context, it's really critical to make sure that we're spending resources, and by resources I mean money, but also time, on evidence-based strategies and the best bets from the evidence. So that means that those leaders in those settings should make sure they're doing two things. First, they should cautiously consider strategies that don't have any evidence. And I'm going to talk through some of these programs, particularly knife education programs, trauma-informed practice training, and police in corridors and classrooms. On these programs, we're not saying they don't work. We just don't know if they work or not. And so there are probably better evidence-based bets, and I'll come on to that. There are also some approaches that have actively been shown to be harmful and should be avoided, particularly prison awareness programs. So let's start then with some of these strategies that we don't have any evidence for either way. We don't know if they work, we don't know if they don't work, but we don't have any evidence. And therefore, they should be approached with considerable caution before schools decide to deliver them. And in most cases, we'd argue that there are better evidence-based bets that we feature in recommendations 1, 2, and 3 of the guidance that schools should pursue. One really good example of this is knife education programs. 47% of the nearly 9,000 secondary teachers we surveyed in 2025 say that their school is delivering knife crime awareness assemblies. Perhaps even more surprising, in that same survey, 57% of secondary teachers say that they think that knife education programs are evidence-based responses to prevent children's involvement in violence. Now, neither of those things, those stats are slightly concerning for us because there's no evidence to suggest that knife education programs protect children from involvement in violence. Now, they're typically one-off short sessions of 1 to 2 hours. And they'll often involve external organisations coming in and talking about the dangers of knife crime, talking about why knives are dangerous, why you shouldn't carry them, and often sharing stories, photos, and videos that depict the impacts of violence. Often those stories and photos, not always, but often they're quite graphic and can be upsetting for children. Now, proponents of these would argue that it's really important to explain the dangers of knife crime to children. But we have a worry and do worry that what this might sometimes be doing, particularly in a space where we don't have the evidence to know if they work or not, is that it might make children feel less safe. If you go into the school and say, lots of people carry knives, you shouldn't, and they're really dangerous, some children might respond to that by thinking, oh, hang on a minute, everyone's carrying a knife. I need to carry a knife too. In our survey of 11,000 children last year, of those who admitted carrying a knife, 47%, half of them, said they did so for self-protection. So if you go into a school and increase the perception of danger, what you might be doing is encouraging more children to carry knives. And that certainly concerns us. As I say, we don't know if they work either way. And so in the absence of evidence, we're very keen to encourage people to exercise caution. We are about to set up an evaluation of some knife crime education programs so we can provide some more information on this in the coming years. The second approach, where there's not a lot of evidence, and we'd really encourage cautious consideration, is police in schools. Now, it needs to be really clear when I start a discussion on police in schools that it's so critical from a safeguarding perspective that the police and education settings effectively collaborate with each other. And indeed, that is mandated as part of statutory safeguarding guidance. And there are some really fantastic examples, Operation Encompass being a really brilliant one, of how that's done across England and Wales. For those of you who might not know, Operation Encompass is the initiative that all forces across England and Wales deliver, that when they intervene in an incidence of domestic violence or abuse, they must, before the next school day, inform the designated safeguarding lead at that child's school so the school can support the child upon their return to school. That's fantastic, that's brilliant, and that should of course continue. Where we should be slightly more cautious is actually having police in schools. And this tends to happen in two ways. Either policing corridors, patrolling corridors, and intervening behavioural incidents, or in classrooms teaching content. And police will often teach content on a range of topics like the dangers of knives, drugs, and the law. Now, lots of teachers and schools swear by the safe schools officers that head in school and have had really positive experiences, but we don't yet know from a violence reduction perspective. There haven't been many robust evaluations of whether having a police officer in school reduces children's involvement in crime, and it also comes with some risks. So we're really clear that if you are using police in schools, make sure you implement carefully. By that, I mean set a specific aim for the presence of the police. For instance, that might include building trust between the police, children, and the community, or using a police officer as an additional trusted adult. Be really clear about what your aim is. Make sure you set clear boundaries for the police officer in school that school leaders are really bought into and very clear on, and make sure that you're following any statutory guidance when any searching or confiscation is happening with children. And then really critically, make sure you're communicating, yes, with children, but also with parents and carers about why the police might be in school in your context and the safeguards that you have in place. This is another area, incidentally, that we're currently doing an evaluation on. And in the autumn, we'll be publishing a robust randomised control trial on the impact of police in schools in classrooms that we've worked with the PSHE Association on. The third area where we have limited evidence and education settings should exercise caution is trauma-informed practice training. Now, it's a really nuanced and complex part of the guidance here that we need to be really careful in being very clear about how we articulate and communicate this. And that's because we know that trauma matters. having adverse childhood experiences makes it more likely that a child will later become involved in violence. We published some really interesting analysis on this last year that showed that if a child had had more than 2 adverse childhood experiences, there were 19% their level of risk was 19% higher for involvement in assault. It was 45% higher if it had 6 or more ACEs. We know that trauma matters. It has an impact on children's later outcomes. Therefore, it's pretty sensible to acknowledge the impact that can happen, the impact that trauma can have. It's pretty sensible to reflect that in approaches to behaviour and making sure that teachers and schools are curious about the causes of behaviour, and they're also providing targeted support to children who might be struggling as a result of adverse childhood experiences. There are also some quite specific strategies that can be delivered to children who've experienced trauma, like trauma-specific therapies delivered by trained clinicians that have been shown in the evidence to reduce children's involvement in violence. What we know much less about, and what a lot of schools are doing, is trauma-informed practice training for teachers. There's not much evidence at all on the impact that training can have on children's outcomes. And so we're clear on this, that if your aim is violence reduction, there are very likely better evidence-based bets that you can deliver that we feature in the rest of our guidance. So whether that's targeted mentoring or targeted sports provision, whether that's developing children's social emotional skills through universal curricula or targeted intervention, whether that's anti-bullying programs, whether that's therapeutic support in the form of CBT or trauma-specific therapies, they're likely a better use of resource from a violence reduction perspective than trauma-informed practice training. If you are delivering it, one of the really key things we'd encourage you to do is be very clear about what your definition is. Often a challenge with trauma-informed practice training is it can mean different things to different people, and also very clear about the specific actions that you want teachers to take. We're actually publishing 2 randomized controlled trials on Friday of trauma-informed practice training interventions in schools. Can't reveal what the results of that are yet, but what is certainly clear from the wider evidence that it's challenging to deliver trauma-informed practice training and show an impact on children's outcomes. And there are likely better evidence-informed bets from a violence reduction perspective. Now, while those 3 examples, knife crime education programs, trauma-informed training, and police in schools, are areas where we don't have any evidence, there are areas where we do have evidence, and that evidence categorically says that these interventions should not be delivered. And one of these is prison awareness programs. Now, the most famous example of this is a program in America called Scared Straight, which was delivered for a very long time in America. And this is where children were taken, children who may have been struggling with their behaviour, had previously been excluded or suspended, were taken to visit a prison and told, basically scared, and told, you are going to end up here if you continue behaving in this way. Another version of this program is former prisoners will go into schools and talk to children about what prison is like, again, to try and scare children. The research is clear here, and randomized control trials have now been conducted on the Scared Straight program in America, where some children received a prison awareness program, others did not receive a prison awareness program, and children who received the prison awareness program were more likely to offend and were more likely to be violent than those that didn't. This is a harmful intervention. Thankfully, only 1% of teachers report that their school is delivering visits to prisons, but 5% still report that schools host assemblies where prisoners explain what prison is like. Now, relatively, that's not a big number, but absolutely, that's still a decent number of schools, and so we really encourage schools not to be delivering prison awareness programs. The final point I'll make before I hand over to Ben to talk us through the relevant sections of the EPIC self-assessment tools on these recommendations is a new addition to the pupil premium guidance that should really support you in making evidence-based decisions in line with these recommendations. So last month, a new addition was added to pupil premium guidance, which says that schools, colleges, and AP settings can spend pupil premium money and funding on interventions that reduce children's involvement in violence. They could do that previously, but this is now made more explicit, and there's explicit reference here to the education practice guidance. And so I'd really encourage you, if you think you have a challenge with violence in your school and you think that's impacting children's attainment, particularly those children who are disadvantaged, have a think about these interventions that you can deliver and then evidence that in your pupil premium strategy. Over to you, Ben.
Thanks, Joe. For colleagues that joined the last couple of sessions, you may remember that we introduced the EPIC self-assessment tool, and thanks to Joe and Alison for having done so earlier in the call. Very simply, it's a free online self-assessment tool for any education setting in England and Wales. It takes 30 minutes on average to complete, with 37 questions posed to you as a user. In return, you receive a free downloadable and personalized insights report. There's opportunities to kind of benchmark how the practice in your setting compares with other schools across a range of metrics, from schools in your local area to nationally to similar percentage of free schools and meals, etc. We thought it might be helpful to just bring in a reflective exercise with some of the questions on the self-assessment tool, all centered around the recommendations that Joe set out for key recommendation number 4. So using the scale of if a practice happens, never, rarely, sometimes, often, or always, we have 4 questions to ask you, and we'd welcome you to reflect either personally or if you're sat with a colleague to perhaps discuss for a couple of seconds. So the first question is all around: do you provide access to positive activities such as sports or art activities after school or college? And this is when children are most at risk of involvement in violence. The second question is centered around surveying. So do you consult with children in your context to understand which times, locations, and aspects of violence to focus on? And in a similar vein, do you consult with staff to determine where to focus your efforts? And lastly, do you work with local agencies and partners to understand your local context and to create a coordinated safeguarding response? So as I mentioned, there is the opportunity to complete 37 of those questions. So if there's 33 other questions that we didn't give you access to, but we'd love for you to complete that online on the self-assessment tool. The link is there. There is also a QR code that will allow you to access it. I will pass you back now to Alison for the opportunity for a Q&A session.
Thank you very much, Joe and Ben, for that really insightful session. So we've got some time for some questions. We've got about 10 minutes left. I'm going to start with the question that has gone into the chat from Julia, and then we've got some others that have been pre-sent in to us as well. So Julia asks, does anyone have an idea for supporting the delivery of programmes after school that doesn't apply more pressure on teachers? It's a great question. She talks about lack of funds and it can be quite tricky. What do you think?
Yeah, this is a really fantastic question and something that came up a lot when we were drafting the guidance and in conversations. And actually our teacher tap surveys around, some of the challenges that are associated with delivering these sessions. And one of the key things I'd say is it doesn't necessarily have to be schools that are delivering these sessions. We know also from the evidence, youth clubs can have a really profound impact on protecting children from involvement in violence. Another thing that we're seeing a lot of schools doing is proactively schools doing this, but also local third sector organisations proactively reaching out to schools to do this as well. And whether that be youth sector organisations, but also sports clubs. So we're funding a project at the moment with the Rugby Football League, who are delivering a mentoring in sports programme targeted at particular areas where they might be worried that children might become involved in violence, and also supporting particular children who the school might be worried about. And taking the onus of teachers away from having to deliver those sessions after school. Similarly, with regards to those sports interventions, it doesn't have to be a local sports club, but whether it's local youth workers, there's arts interventions as well. Really leaning on the third sector and on other organisations can really support schools to do that.
That's a really great answer, and I would always encourage a trust or a school to think about that conversation with their local authority colleagues, because often they can help leverage some of that targeted youth work and the other organisations that exist in that area. Did you want to jump back in on that, Joe?
Yeah, and just to build upon that, I think this is another reason why it's just so important to be doing that multi-agency collaboration, because otherwise you do run the risk of duplicating things, and actually just having that conversation with local partners, with local policing partners, health partners, local authority, justice service, to say, what are you all actually delivering? Because they will all, as particularly as part of serious violence strategy work, and also just more generally as part of local safeguarding efforts, other interventions will be happening, will be being delivered. So making sure that's coordinated is really important.
Great. So the next question is linked to this sort of second part of the webinar, which was about where there's limited evidence or no evidence. So we don't know whether police in schools reduces violence, but is there any evidence on the broader impact that they may have?
Yeah, it's a really good question. And you know, I hope, like in setting out in the webinar on the lack of evidence, what I'm talking about there is specifically the lack of evidence on violence and crime related outcomes, whereas the other things that we talk about earlier in the guidance around mentoring, around therapy, around targeted sports provision, social emotional skills, they've shown an impact on crime and violence related outcomes. There is broader evidence. So a couple of studies that have been published in the last 20 years on police in schools. There's one from about 20 years ago of a national evaluation of the Safer Schools Partnership Programme, which I think is, you know, Safer Schools officers is what a lot of education leaders will recognise as police in schools. And it was a really interesting evaluation where they looked at 15 settings that had a Safer Schools officer and some schools that didn't. And it looked like the programme reduced absence, but didn't have an impact on suspensions or exclusion. That is quite some time ago now. A more recent study was a more rigorous randomised control trial in 81 schools across England and Wales. And that looked at, again, whether having police in classrooms improved a range of different outcomes. And those policing classrooms were teaching about drugs, they were teaching about the law, they were teaching about the dangers of knives. And the trial found positive impacts on children's perceptions of the police, but it didn't measure the impact on crime and violence. So again, if that's the aim, if that's the stated aim, then fantastic. Like, you can pursue that. If the stated aim is violence reduction, then at the moment there are other evidence-based bets. I did mention we're really excited. We've been partnered with the PSHE Association and an independent evaluator, and we're currently testing a randomised control trial, a very large randomised control trial with over 30,000 children, looking at the impact of police in classrooms on children's behaviour, and that will publish in the autumn. So hopefully we'll have some more information then.
Great. And there's lots that can be read on this, I think, as you dive into some of this literature, if you're very interested. If my school is one of those that are delivering a knife education programme, how can we ensure it's implemented in a way that's not damaging to children?
Very good question. The first thing I say, if your school is delivering a knife education programme, I'd ask you to firstly think very carefully about whether you should be, and think very carefully about, are you doing all of the other things in the guidance, and might you be able to use your resource better on an evidence-based bet, is the first thing I'd say. The second thing I would say, if you are, and if you still think, no, I think it will add value, and as I say, we don't have robust evidence either way to say whether they work or not. We have evidence that other things work better, but we don't have evidence to say either way whether they work or not. If you are, there's some things you should definitely consider. Firstly, can you do anything to embed social and emotional skills development into those sessions and talk about skills that children need to develop rather than just a focus on the knife? Secondly, you must avoid graphic and upsetting content. It doesn't serve children. These are children, and ultimately these are often delivered to universal settings, the vast majority of which of children will never pick up a knife, and we shouldn't be traumatizing them while they're in school. The other really critical thing that we should say, and it's fantastic, this is in the new RSHE curriculum, you must be clear to children that knife carrying is uncommon, and you don't need to carry a knife to keep yourself safe. The danger that comes with knife education programs is it leads to a misconception that everyone is carrying a knife and a child needs to carry one to keep themselves safe. You must be very upfront that knife carrying is not common. Other things to do is just make sure you very closely manage any group discussions that happen. Like if group discussions are happening in the session and children are, you know, saying I've carried a knife, you know, you need to make sure that you're managing and listening to those and then can intervene from a safeguarding perspective. And similarly, providing follow-up support after the sessions if children are upset by them, or if they've, you know, absorbed the session and think I need to talk to a member of staff about something that I've heard.
It's really helpful, Joe. I think we heard you quite strongly, you know, really think about that intervention. And one in the sidebar from Sarah, thank you, Sarah. How do schools and the other community partners know if they are in areas of violence hotspots? Does the duty put the impetus on the local authority to reach out to schools and providers in those areas to tell them where those hotspots are? Or do schools need to find that out for themselves?
Yeah, really good question. Well, I'd say so. The serious violence duty applies to all of England and Wales. I think within all areas, and what we'd hope the sort of prevalence of violence stats sort of like demonstrate, particularly through our survey of children every year, in all areas there are like children are involved in violence. 1 in 5 children across the country report being a victim in the last year. Like this is something that's prevalent. It's even more prevalent for relationship violence. You know, that's something we spoke more about in the last webinar. But relationship violence and particularly violence against women and girls within relationships is even more prevalent and happens everywhere. And so even if you might think, oh, you know, I'm in an area where there's not a particular violence problem, it's still really important to target your resources. There will be children in your school who are at risk of involvement in violence. And there will certainly be children in your school who are at risk of involvement in intimate relationship violence. And so speaking to local partners about understanding your local context is really important.
Thank you. So it is about being part of those multi-agency arrangements, isn't it? And really sort of starting to understand intelligence. So I think the answer to Sarah's question is you should get a lot from your local authority, police and health partners, but you should also ask questions into the partners. A bit two-way almost would be the right way to approach it.
And also, sorry, Sarah, to say, yes, the serious violence duty does put the impetus on those partners to reach out to schools. But also, you know, make sure you're ready for that engagement, right? And make sure if it hasn't come, you can also reach out.
Yeah. Specific question we've got submitted around health. So we've talked quite a bit about police, haven't we? But how do you see the role of health partners in this, particularly, I guess, working with children with difficulties in their mental health?
Yeah, it's a really good question. It's a question we get a lot. Health play a really critical role here. And one of the key reasons for that is one of the most evidence-based interventions that you can deliver to children at risk of involvement in violence is therapy, particularly cognitive behavioural therapy. And so education settings, working where they can, and I know, you know, there's real limitations on capacity of CAMHS, but working with CAMHS to refer children there that they're worried about is really important. Where those limitations are at such a level that waiting times are too high and schools are worried about it, we are seeing some really interesting practices of schools sort of stepping into that space and working with third sector organisations to provide therapeutic support. There are examples of trusts employing their own mental health specialists, but also the fantastic mental health support teams in schools programme. And, you know, really large numbers of schools now have a mental health support team in school, really thinking about, you know, can you be using the therapeutic services they can provide to provide services and therapy to children who might have been suspended or excluded from school, or children who are struggling with their behaviour, rather than just children who are, you know, anxious or depressed. It's really important, of course, to provide therapy to those children, but really thinking about how, as a school and an education setting, you might improve access to therapy is really valuable.
Thank you so much. I'm going to stop now with the questions, but thank you to those who submitted them, and thank you, Ben, for providing some answers to those questions. So all that it leaves me to say is thank you very much for your engagement with this series of webinars. We are very grateful for your attention and your time on this most serious of matters. And as I said at the start, we've YouTube recordings of all of the sessions, which we'll put links in the sidebar to and make sure people have access to. I'd be so grateful as well if you could share them in your networks. If you know a school down the road or colleagues in your school who you think would also benefit from this, please do share the links. Please do complete the EPIC tool. I think if you do so, you get a report. It's, give some time to do it, but you will get something back in return. So please have a go at doing that and have a look at all of the information that the EF have published over time as well. And the final thing is to say, could you please also complete our survey form? Again, there's a link to that in the sidebar. We'd be really grateful for your views on how useful you have found this session today and the sessions prior to it. And that will allow us to craft better sessions for you in the future. Thank you very much to the team of DFE officials for putting this on, and for our colleagues in the F who've supported this. I know behind Ben and Joe, there's a team of people who work really hard to generate all this evidence and evaluation, and the DFE is very grateful to you for that. So thank you very much. Enjoy your evening. There is sunshine outside, and thank you for your attention today. Take care. Bye-bye.